A very good morning to you and welcome to Stopping Medical Tourism. I am Joseph Kadri, and today we shall be looking at one disease, if you like, well, lifestyle if you want. Some people like it. They want to add weight, they want to be big, protruding tummy, and the women, you see them with very, very, expanded arm and all of that. But it is not good. Obesity is what we shall be looking at today. The causes, the treatment, and prevention. Obesity leads to so many diseases. And you will hear that through a consultant orthopedic surgeon with Asokoro General Hospital and the medical advisor to Alliance Hospital. When I get to this point, I always want to pause and say big thank you to Alliance Hospital for always giving us the human resources to, of course, tell you what you need to know about your health. And I am sure the calls that we have been getting, even after the program, we still get calls to say, thank you for enlightening me on the effect of smoking. Thank you for enlightening me on bull leg. Thank you for enlightening me on hip replacement surgery. Thank you. It is just endless. Dr. Christopher Otabor, very good morning to you.
Thank you
for having me. Today, we are going to be looking at obesity. It looks, beautiful when you see that expanded arm and protruding tummy.
Is it really beautiful?
Yeah, so what do we need to know about obesity?
Okay, yeah. So thank you very much for having me once again. Obesity simply means excess body fat. And there is an objective way of assessing excess body fat. But the commonest method is by what we call the body mass index. Because there are many people who are obese, but they don't know that they are obese. And there are millions of people who are overweight. Okay, so the body mass index takes into account the weight of the individual and the height of the individual. Because if someone is very tall, his weight is expected to be higher than the person that is very short, even though they have the same fat distribution. So the body mass index is what is used to assess for obesity. Now, what the formula is weight in kilogram. You divide that by square of the height. The height is in meters. So let's say 90 kilogram and I'm 1.6 meters tall. So my body mass index will be 90 divided by 1.6 squared. So what I'm expected to get,
that is 1.6 times 2?
1.6 times 1.6.
You have, 1.6. You have something you keep
yes.
on one side.
So 1.6 times 1.6. Thank you. You now divide what you get. You now put 90 and divide it by the result of 1.6 squared. So that's what you get as your body mass index. Now, let me explain the range. The range is, for normal body weight, it's supposed to be between 18 to 24 kilogram per meter squared. Being that you have kilogram, 18 to 24 kilogram per meter squared. That's normal. Anything less than 18, we are going into another problem, which is undernutrition. Okay? 25 to 29 is overweight. And a lot of people fall into that category, especially adults. Then from 30 to 34 is obesity. Okay? From 35 to 40 is morbid obesity. That means you need to do something about this now. Then from 40 to 45 or 45 and above is super obesity. That means...
Before we get to the morbid
yes.
and the super,
yes.
let's look at the overweight and then the obesity, which is from 29 to 34, no, from 25 to...
From 25 to 29 is overweight.
Then from there to 34
is obesity. Yes.
What is the effect?
Okay, now, first, let me just talk briefly about the causes. To a very large extent, the way we are built will be determined by our genetic factors. That's the gene that we inherited from our parents. But working upon the genetic factor are the environmental and social factors, like access to food, that's the social status of the individual, then absence of exercise. There are some hormonal factors. There are some people that have some hormonal imbalance, like excess cortisol, in Cushing's syndrome, and so on and so forth. Then sedentary lifestyle, when you are not doing anything, eating habits, you eat a lot of junks, even in the lower social status, you still have obesity because they are eating wrongly.
So it has nothing to do with social class?
No, there are so many poor guys that have severe obesity because they are eating the wrong stuff. Yeah, so, okay, now, talking about the effects of obesity. Obesity is one problem that can reduce the lifespan of the sufferers. Yeah, because the problem is, it affects almost every part of the body. Now, the size of the heart of every individual is like their fist.
Determined by their feet.
No, if you make a fist, that fist is that's the size of your heart. And you will notice that in obese people, no matter how big you are, your fist will not get big.
It's true.
That means that your heart does not get big to compensate for the size of your body. So if you are getting bigger, you are giving your heart more work to do, because it's still the same heart, but now it's supplying maybe 2 times the original size that it's supposed to be, sometimes 3 times. And a time will come when the heart will tire out. And if it does that, it leads to heart failure, it leads to so many other things. Then obesity also predisposes to chronic diseases like diabetes, like hypertension. Yes, and these are, we've discussed diabetes and hypertension many times on this program.
You said there are risk factors to stroke.
Yes, exactly. So obesity is a risk factor for diabetes, and diabetes, of course, is a risk factor to stroke. Even obesity itself can also predispose to excess fat in the vein, in the blood vessels, the arteries, which can block and also lead to stroke, and so on. So cardiac arrest is commoner in obese people than in the normal population, because the fat is blocking everywhere. It could also block the blood vessels and lead to a stroke or heart attack. So in terms of obstetrics, women giving birth, if one is too obese, he may not be able to get pregnant. Yeah, because...
So that it means it affects fertility?
Yes, it can lead to infertility. Obesity can lead to infertility. Yeah, that's been proven. Yeah, so then in cases where people need surgeries, obesity is a problem. Anesthesia is a big problem for obese people, because their neck is fat and stout. It's difficult to get them in the right position to pass the tube for anesthesia purpose. And also, wound healing is a problem, yes, for obese people. The wounds will not get healed on time because of excessive fat and all that. Then they are also at risk of apnea. That's problem with breathing. Yeah, because obese people suffer from snoring more than the normal weight people. Yes, so sudden death is commoner in obese people because their breath can cease, and that can lead to death.
Well,
so there are so many things.
All that you have said is very, very interesting, and just to re-echo that, and as it touches you, just have to try as much as you can to begin to look for solution. A lady, you have difficulty in, of course, conceiving. It may be because of your size. I need to find out, and that has to be in a health facility. You have problem with breathing. Well, you need to find out what the cause is. It may be obesity, and of course, doctor talked about risk factors. I mean, what it can lead to. It can lead to obesity. Can lead to diabetes to several heart problems, and you also need to check that out in a hospital. I don't need to tell you, it's just there. Just go there, you go to that place, and all of that, of course, will be provided for you. All you need will be provided for you. Now, let's also look at the treatment for obesity.
Okay, yeah, thank you. It's not all obesity that will require hospital care. Yeah, the reason for classification of obesity is so that you can track your weight. Because there are many people who are just happy with themselves because they look good, they dress well, they appear nice. But the truth is that they are obese. And except you know the indicators, you will not begin to do something. And by the time you want to start doing something, you may not be able to, because as we get older, we also get the tendency for us to add weight is there because we become less active, unlike children who can burn their fats, quickly. We become less active. So by the time you cross the red line, you may never know. So the treatment for obesity is conservative. We always counseling.
So sorry, before we continue on that treatment, can obesity affect bones?
Yes, but in terms of bones, one advantage of obesity, weight, is that it gives protection to the bone. Yes. If one is big, because your bone strength is maximum at the age of 30. If one has weight, then your bone strength through life has some advantage. That's the only one advantage of being big. Yes, so for big women, they are not likely to suffer insufficiency fracture. Like little fall, you have a fracture as it happens in postmenopausal women. Yes. So treatment for obesity can be conservative or surgical. Conservative treatment is lifestyle modification. We advise on less food, more exercise, because the difference between what you take in and what you burn is stored for you as fat. That's just the simple mathematical calculation. Let's say you take in 5,000 calories in a day and you are only able to burn 3,000 calories. The remaining 2,000 calories will be converted and stored for you in your body as fat.
And accumulation of that leads to?
No, yeah, it's simple. Because even if you say it's Coke you are taking or it's Gari you are eating, eventually that Coke or Gari would, if you don't spend it by way of activity, it will be converted to fat and stored in the adipose tissues, waiting for the day you might need it. Of course, some people may never need it because before they keep adding every day. So if we can reduce the intake of calories and increase the burning of calories, then that can help. And how do you reduce intake? Create a balanced diet. We're not saying
The number is on the screen for you to call. We have just 10 minutes to pick calls, and we want that as fast as possible.
We're not saying starve, but we're saying create a balanced diet. If you have a bowl of food, half of it should be vegetables. All this carrot, cabbage, whatever, garden egg. The remaining half, divide it into two. The other half would be for your carbohydrate, like eba or yam or gari. Then the other quarter would be protein. Yes, but there are people who can sit down and finish a whole chicken. That's not good. You may have the money to do that, but you are not helping your system. Yes, so that talks about the reduction in energy intake. Then for energy expenditure, exercises. If you can take 10,000 steps in a day, you can lose so much weight within a short time. And the exercise is not about just doing once and go. Cultivate the habits. In somewhere around Abuja, I see a lot of people doing brisk walking, jogging. That's very encouraging. We need to do, but what is more important is the consistency. If you can't afford a gym, go out there, look at places where communities, gather and they help themselves. But in severe obesity.
But if one is to, of course, take one of the preventive measures, which is exercise, how many minutes should somebody be engaged in exercise?
1 hour exercise in a day is good. 1 hour exercise. And then if you walk, park your car far away from where you walk, so you can trek to work and come back, pick your car. In this environment, people, when they see you trekking on the street, they are wondering, is there any problem? There doesn't have to be a problem before you trek. Because, it helps, it's good. Yes, for the severe obesity, there are surgeries, like the surgeries we do. Yeah, we call them bariatric surgeries. There are bariatric surgeries, there are vanity surgeries. Bariatric surgeries, you reduce the size of the stomach such that you can't take so much food.
We'll continue from there.
Okay.
Hello, good morning. Hello? So we'll continue with the...
Okay, yeah. So you reduce the size of the stomach such that very little food will make you full. And that you can lose as much as 40, 50 kilograms of weight within 6 months. And that has helped a lot of people. Yes, we do it endoscopically, so you don't even need to open. And within 2 days, you are back home.
And can continue with your
regular things. Yes, for those who can afford it, we can advise that. Then,
yeah, but this is one of the leading causes of medical
things. Yes, no, a lot of people go abroad for it, and yes, I don't see.
How much is it if we are doing it here?
Well, it's expensive. Yes, it's expensive. It's not less than 1 million. But those who can afford it that go abroad, they pay as much as $40,000 to $50,000.
Hello, good morning, doctor. Let me hold you there. Hello, good morning. Hello. Hello. Good morning.
Morning.
Your name and where you calling from? You are calling from where?
From
Okay. Quickly, what is your question or comment?
Yeah, actually, obesity issue. What is the cause? We see that a small child, from 10 to...
Okay, you are asking of obesity in children.
Yeah, it's
all right. Thank you. Yeah, thanks for calling. Just listen to the answer.
Obesity in children is increasing now because, though there's general poverty, but there are wealthy families now, so children have access to food and all that. Then there are also problems, children who have health problems that makes them become obese. It's the same thing. Yeah, it's just that they need some more supervision in terms of the exercise and the diet. So obesity in children is increasing in our environment.
Hello, good morning. Hello? Okay, but surgery you talked about is really interesting.
You know, it's done, we do it, and the result is fantastic. Then the second surgery is tummy tuck or reduction of stomach fat. Some people, they are okay with the other parts of their body, but they don't like the fact that their abdomen is protruding. So we also reduce that. You do liposuction, take away the excess fats, and they look good by themselves for themselves. Another complication of obesity that I didn't talk about is the psychological aspect.
Hello? Good morning. Your name and where you calling from?
Good morning, sir.
Yes, quickly, your name and where you calling from? Please, can you speak up? I can barely hear you. Okay, Mr. Richard, quickly, your comment or question?
I'm hearing this discussion and then I'm not observing, but I want to ask people who don't fight, what causes the problem of not fat? Because I want to become fat.
Okay, Mr. Richard, thanks for calling in. He'll answer.
People have different problems.
Yes.
He wants to be fat.
To add.
Yeah, because there are two extremes to it. Okay, something else I forgot to talk about obesity. Big people have the predisposition to arthritis, in which case they will eventually require joint replacement surgery. They also can have back pain because of the excess weight on their body. Yes, so, well, if you are not fat, but you are normal weight, I will advise you to stay that way.
Hello, good morning. Please, can you tune down the volume of your TV set? I reduce the volume of your TV set, or you walk away from your TV set. You don't have to monitor yourself or listen to yourself. Hello? Oh, lost that.
Yeah, you know, sometimes in some societies, obesity is a status symbol. When you are big, people think you are feeding well and you are rich. But all that is changing now. But with enlightenment, obesity, in fact, in Western world, is those slim fit guys that are known to be rehab. Yes.
Hello, good morning.
Hello.
Your name and where you calling from?
I'm calling from Airport Road.
Okay, quickly, what's your question?
I want to ask about that.
Go on.
I have it.
Okay, you have diabetes.
I don't know which medicine I can take.
You have to see your doctor that will sit with you, advise you on the disease, and then test your blood. Your blood level will now determine, your blood sugar level will now determine what your doctor will do for you. You have to see your doctor.
Yes, and of course the contact there, you can lay your hand in one of them and call. Lay your hand in one of the contacts there and call, and just be sure that diabetes will be a thing of the past. Doc, before we go, your final word. And it's just a good news when you say diabetes can be addressed via, obesity can be addressed via surgery, and it is obtainable here in Nigeria. Many hospitals are doing it. Alliance is also doing it, and it is at 5 Manufacturing Close here, area 11, Garki, Abuja. But before that final word, yes, let's go.
Okay. Obesity is a big problem, and we can do something about it to prevent sudden death or complications. And we have to take responsibility for our health. Yes, you can stress yourself a little to exercise and reduce what you eat, because the difference between what you take in and what you burn will be waiting for you stored as fat. See your doctor, work with your healthcare practitioner, your nutritionist, to take away the excess fat so that you can live healthy lifestyle. And if you need a surgery, you don't have to go abroad. We do gastrectomies, we do tummy tuck and all that.
You don't need to go to abroad. All of that is done here. Gastrostomy and tummy tuck, they're all, of course, obtainable here. 5 Manufacturing Close, area 11, Garki, Abuja. to be precise, Alliance Hospital. Well, the much we have on today's edition of the program, the calls are still coming in, but the problem is with the time. So even after the program, you can still you can still call, and then we'll pick and advise you on what you need to do. Many thanks, Dr. Otabor. Until I come your way again, I'm Joseph Kadri. Bye for now.